It's your dude here once again from What You Think. A rare fungal infection has appeared in an uncommon part of the U.S. New research published on Wednesday shows called Blastomycosis. The illness was thought to mainly occur in the northern Midwest and parts of the Southeast. But the new study found that it has also appeared in Vermont. According to the study, published in the Centers for Disease Control and Prevention, Emerging Infection Diseases Journal, blastomycosis is usually well known in areas around the Great Lakes, the Ohio River Valley, and the Mississippi River Valley. Dr. Arturo Casadevall, chair of molecular microbiology and immunology at the Johns Hopkins Bloomberg School of Public Health, said, Vermont is not generally an area you think of when you talk about blastomycosis, but there have been several papers suggesting that fungi infections are on the move across the country, and this is one of them. Excuse me. Blastomycosis can be difficult to diagnose, in part because it resembles other respiratory infections and is therefore difficult to treat. The infection is caused by a fungus called Blastomyces dermatidis, which thrives in wet soil and decaying leaves and logs. The infection is considered a type of fungi disease that only occurs in a specific geographic area, also known as an endemic mycosis. Dr. Brian Bohr, lead author of the study and a medical director at the Chicago Department of Public Health, said that blastomycosis is one of many fungi diseases nationwide that have been changing. Blastomycosis can cause respiratory symptoms, fevers, and body aches, and in severe cases, it can lead to serious illnesses or death. Casadevall said, one of the great problems with fungal diseases is they are unreportable. Outside of Arkansas, Louisiana, Michigan, Minnesota, and Wisconsin, which all have public health surveillance for blastomycosis. The prevalence of the disease is unknown. Bohr said that there have been some reports of blastomycosis cases in the Northeast, including reports from doctors and veterinarians in Vermont. Dr. Bruce Kleen, a professor of medical microbiology and immunology at the University of Wisconsin-Madison, explained that pathogens could be riding on shoes when people travel, causing cases to appear in uncommon states. Kleen said Blastomyces dermatidis grows as a mold, and the mold produces spores. When those spores are physically disturbed, they become aerosolized and are breathed into the lungs. Climate change could also explain the recent changes, as it shifts rain patterns and increases drought in some regions. An environment that favors certain fungi and more flooding in areas. Extreme weather events such as storms, flooding, drought, and hurricanes could impact soils and redistribute fungi, according to researchers, which would increase human exposure to fungi. People who are immunocompromised are most at risk for severe fungal infections, but blastomycosis usually occurs in otherwise healthy people, Clean said. He said, "This is a remarkable distinction from many other fungi that are more feeble and prey on people whose immune system are impaired by things like biologics. However, most blastomycosis cases are mild, and about 95% are fully treatable with antifungals," Clean added. Well, folks, that's it for this one. I just wanted to keep you updated. Stay safe, stay prayed up, be blessed, keep pushing forward.